The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Happy Wednesday. I do see quite a bit still jumping on, but we wanted to go ahead and get you guys in and let you guys know that we are waiting for more folks to join. Welcome to our Redetermination Learning Series this morning, June 28, 2023. Just to see if everybody's connected. If you guys want to start using the questions box, let me know what you're having for breakfast, if you're drinking coffee, tea, how you're doing this morning, water. Okay. Coffee. English muffin with peanut butter. Oh, that sounds tasty. Hello, Holly. Yes, awesome. I haven't had coffee yet, so I am hoping later this morning I'm able to get a drink of a cup of coffee. So orange spice tea. I like spice tea. Good morning, Sean. Boiled eggs. Awesome. If anybody's having any technical issues, we'll go over housekeeping items, how to navigate GoToWebinar. But if anybody's having any technical issues, please let us know on the chat. We'll be able to troubleshoot those with you, hopefully. But it sounds like everything's working, and I keep seeing a lot of coffee drinkers, tea drinkers. Yeah, oatmeal, awesome. All right, well, we're gonna go ahead and get started again. Welcome to our Redetermination Learning Series for June 2023. We're gonna be focusing today, it's gonna be rather a short webinar. We might not be able to be here for an hour and 15 minutes, but that also depends on whether we have a lot of questions to address at the end of the webinar. So depending on the questions, or not, this might be a really short webinar. We are going to be going over the Authorization for Community Partner Help Form, well known as the OHP 6610. We'll be doing a walkthrough through the form server. We'll let you know what the form server is, how to get that form on there. And then we're gonna be going over remote signatures, again, and as a community partner, what you're able to do once you get that consent form signed and dated by the member. And without further say, we're gonna go ahead and start with introductions. Good morning again. My name is Rosa Armenta. I'm a Regional Outreach Coordinator for the Northeast region. So I cover Umatilla, Morrow, Wallowa, and Union counties. And I have with me my colleague, Alma, so I'll just give it to her so she can do her introduction.
Thank you, Rosie, and good morning. Buenos dias to everyone who's joining us today. As Rosie mentioned, I'm a Regional Outreach Coordinator for the Southeast region of the state. Her and I share the eastern part of the state, so super happy to be here with all of you, see a few of you that we know. So thank you for joining us. And I will hand the time back to Rosie to continue with our introductions.
All right, thank you, Alma. And we do have subject matter experts in the room. They're going to be supporting us with, monitoring the chat, answering questions. Again, we will have some time to have towards the end of the webinar to go over some Q&A, but I'll let them introduce themselves. So, Rochelle.
I hope I'm using this system right. This is my first time on this particular webinar system. My name is Rochelle Santiago. I am a operations and policy analyst on the quality support team, and part of our work is to support the ROCs in supporting the CPs and our whole interface with ODHS. Thank you.
Thanks, Rochelle. Han.
Good morning, everybody. My name is Anne, and I am the college with Rochelle's operationals and policy analyst. I'm more confident about self-sufficiency program, but I'm here to learn more about medical and assist Rochelle with, if any.
Wonderful, thank you, Ann. And we also have Christy Taylor.
Good morning, this is Christy Taylor. I'm a Medicaid and CHIP eligibility policy analyst, and I work with OHA, but do fully support eligibility with ODHS as well as one system functionality. Nice to be here.
Wonderful, thank you so much. And Rochelle, welcome to GoToWebinar. And maybe there's some of you that don't know how to use this platform. So this is how a little bit of instructions on how to use the GoToWebinar. So it's mostly on the right side of your screen, you'll see a panel and it'll have an orange arrow. So in order for you to, so if you click on that orange arrow, you'll have a view of your control panel. And the control panel is going to consist of, again, the handouts. You're going to be able to see your handouts. You're going to be able to see the questions box. This is where we're going to be utilizing to input your questions throughout the webinar. And then you'll also see your audio preferences as well. For today's webinar, we are sharing 2 handouts with you. So if you're able to see under your handout section on your control panel, you'll see the Getting Started guide, and then you'll also see the Redetermination learning series. So those 2 are the handouts that you will be, we have provided for you during the webinar. And then again, on your control panel, you will have, you will need to select your preferred audio option. So you have the option of your computer audio, your phone call, or no audio. Everybody will be muted. And once again, if you're having any technical issues, please let us know. All the questions throughout the webinar, just have them posted on your question box, and then we'll be able to monitor as we go through the webinar. So I'm going to give it a few minutes to see if anybody is having any issues with any audio or any technical issues that maybe we might be able to help you troubleshoot. And then Alma, if there's any questions throughout the webinar, please stop me, let me know. As I mentioned, we might have time to address those questions just because it's such a short webinar and the information that we have for you today that we might be able to address those questions as we go through the webinar. So, all right, so I don't see anything, so we can go ahead and get started. So this is what our agenda looks like today and what we will be covering. So we will be going over the Authorization for Community Partner Help Form, well known as OHP 6610, getting consent. We're going to go and do a walkthrough the form server. We are going to be doing going over some information on remote assistance now that we are after the public health emergency, and who can sign the OHP 6610. So we're going to be able to kind of tell you, give you more guidance, especially around authorized representatives, the head of the household. So who are those members that can sign the Authorization for Community Partner Help Form? And how you can assist once an OHP 6610 is completed. So we'll give you a breakdown of all the action items that you're able to advocate for the member once you have a completed, signed, and dated authorization consent form for the partner. And as I mentioned, we will be addressing some of your questions throughout the webinar, but we will also have a little bit of time to go over some Q&A towards the end of the webinar. And with that said, let's go to the next slide. So again, the Authorization for Community Partner Help Form, OHP 6610. This is the form where before assisting a member or an applicant you must be an active certified assister. So you have got to go through the onboarding process with CPOP to become an active certified assister. You must get signed consent using the Authorization for Community Partner Help Form, OHP 6610. Again, that date and signature has to be fully completed in order to be a valid consent form before you send it to the Department of Human Services. The form is only valid, again, if you have that signed signature. It could be a hard signature, and here in the coming up next with Alma, she's going to be talking to us about those remote signatures as well. The form, we'll be able to pull up the form here in a little bit, but the form is a two-pager. So when it says on the final page, it'll be on the second page that you'll be able to make sure that we're including that signature and that date. And you must submit a copy of the OHP 6610 when gathering the signature remotely or when requesting the Department of Human Services staff to add the association manually. So we're going to be going a little bit over, you know, when to submit the consent form. So always remember, if you are working with a member and that form is you're having that signature remotely signed, you must submit that to the Oregon Department of Human Services. Again, it's very important to submit that, because if you're not submitting that, there's no way for you to get associated to the case. I know we have auto association now, so again, those remote signatures, we're going to be seeing them more often. So if you're getting those remote signatures on that authorization for consent form, we're needing them to get sent to the Oregon Department of Human Services. There's many different ways that you can send them, but we know that the workload for some of our eligibility workers those tasks are going to be created when the community partner is sending those consent forms when getting that signature remotely. And if we want to go to the next slide, is there any questions so far? I'm not able to see. Let me pull up my...
There is one question, but we're going to address it later in the webinar. So we can keep going, Rosie. Thank you.
Wonderful. Okay, so I'm going to go ahead and go and do a walkthrough. This is basically we're going to show you how to get the consent form. You do have, just a quick reminder, the consent form is not anywhere within the application, the 7210. So there's different ways to get it, but the form server is your best way to actually get the consent form. So we're going to do a walkthrough on how to get it. We're going to be able to decide whether we're wanting to pull it up via PDF or via the Word document, which one works best. So I'm going to go ahead and have you stop sharing your screen, Alma, and then maybe I can go ahead and share my screen. Let's see if I can share. Okay, wonderful. Give me a few minutes. All right, can you guys let me know if you're able to see my screen okay?
I can see it.
Okay, wonderful. So how often is the 6610 updated? We will let you know once it's updated, but I know a lot of community partners print out the forms just to have them handy. But anytime that any form on the form server is updated, it is best to just continue getting it from the form server directly. That'll be the most updated form that you will get. So this is the form server. It's a publication for Oregon Department of Human Services and OHA. If you're unfamiliar with the form server, you do have an option to selecting a different language. So if you're wanting to see this and go through the form server in maybe Spanish or Arabic, then you're able to do that here in this option. For this webinar, we're going to be searching the consent form. And again, what is the consent form and what number is that? Do you guys remember? Yes. Most of the publications and the form numbers that you will see when it comes from ODHS or OHA, it'll have a form number at in the lower left right hand side of the form. For this one, the consent form, it's called OHP 6610. We're not gonna use the OHA. We're only gonna use the numbers. So we're gonna do 6610. And then I don't mess with any other or try to do any other search criteria on the bottom, like the agency or division, or maybe you're looking for a specific language. You know, I don't recommend you using this one, because once you search for that for that form number, it'll give you options for other languages. So I leave everything the way it is. I just type in the form number and then I hit search. Now, when you hit search, you're gonna come up, and again, this is the section that I was referring to. It'll give you all different. The form is available in all these languages. If there's more languages, you will see that there is page 1 of 6. So if you're looking for a specific language, maybe go through all 6 of them and see if it's in there. In the meantime, we are going to, and it's the very first one. So as you can see, if you click any other one like Somali, it'll highlight it blue. So we are going over again to the Community Partner Assistance Consent Form in English. We're gonna highlight it in blue. Once that is highlighted, we're gonna click View to view the document. Now it'll give you different formats of how you can download that document. So we can view it and download it as a PDF, or we can do it as a Word document. So let's go ahead and just click on the Word document. And this one is a lot user-friendly just because of if you're getting that remote signature over the phone, it does give you a little bit more room to actually have that information on there than the PDF. And I'm so sorry, my internet has been a little bit slow this week actually. And so everything's really slow for me right now. So just bear with me. It is taking longer than usual. I'm so sorry to have you waiting, but as I mentioned, I've been having really slow internet this morning than usual. Yes, and you can make copies, and I think a lot of our community partners do that. So once they have the documents uploaded from the form server, that's what they do. They make copies and they just have them handy when they need them when working with applicants and members. But again, you know, if the form is updated, let's say in a couple of days, and you have copies and you continue utilizing those copies, you don't know when that form has been updated, so you might be using an old, outdated form. So it's always best to maybe keep few copies here and there and then come back, and then, you know, if you're choosing to keep copies handy for yourself, maybe five copies at a time, 5, 10, and then coming back to the form server and making sure that you are working with the updated form. I am not really sure what's going on with my internet, but let me see. Let's see if I can get this going. I just reconnected on my Wi-Fi using my hotspot. Let's see. it came up on my other end. All righty. My hotspot seemed to be working. So we're gonna go ahead and I have it double-sided. Let me fix that. So again, this is your authorization for community partner help form. You'll fill out your applicant or member's information here, name of community partner, name of the application assister, and your assister ID. So then it goes with your the applicant's name, date of birth, their phone number, names and birth dates of other adults on the application, the total number of housing members here, and the number of household members 19 and over goes here. Again, this will go a little bit more about what we're doing and what the member is authorizing you as a community partner to do on their behalf. You will need to have the member go over this information together, and then they can make. And then again, here I just want to point out really quickly. This is important information to go over with the applicant because they can cancel their authorization for community partner organization help at any time. And this is some of the ways that they're able to do so if they choose to. It lets them know what you're able to assist on their behalf and what you may not be able to assist with. My community partner organization and application assister may not charge me a fee for any help. Again, your assistance with providing with enrollment, system navigation, renewals is free of charge. Choose or recommend a coordinated care organization or a health insurance plan for me. So this is some of the items that you may not be able to do as a community partner. Again, having the applicant's signature here and the date is it has to be filled out correctly in order for the Oregon Department of Human Services to accept the form. And in this section is where you're going to be able to provide whether that signature was received remotely. And again, the Word document seems to be working a lot better when reporting those remote signatures here, because the PDF just kind of gives you a lot less space to provide that. So you will be providing your remote application, remote signature here with the dates, and then also lets you know the ways on how you can report this or how you can submit this form. Again, because we do have personal identifiable information for the member, we will need to have you send a secure email to Oregon.benefits odhsoha.oregon.gov. You can fax it. A lot of our community partners do prefer to fax the form, or you can mail it to the one customer service at this address. And I think that concludes a little bit over. Again, we will be going throughout the webinar and going over the remote signatures, but you're able to do the remote signature here, you know, signature received. Via phone, 6/28/2023. So that would be how you would fill out the form. And again, you must go over the form with the member before they are able to sign the form. If you are, let's say, having the appointment over the phone, then you can definitely, it's not so much, you can read this to the member as well, so they know that they are providing a remote signature and what they are agreeing to at that point. Do we have any questions? Or any questions policy or operations would like to see on the chat and kind of clarify now that we are into the consent form?
Hey, this is Christy Taylor. I see a question that's been asked a couple of times about, can we attach the 6610, can we upload it basically into the applicant portal? The answer is to that is yes, when the system allows you to do that. And so there's only certain times, as most of you know, where document upload is allowed, but that's certainly one way you can send it in.
Yes, it's that, and I think we're going to talk a little bit about it. It's the miscellaneous document upload. you will only see that screen when you're running eligibility or reporting a change on the One Applicant portal. So once you're running eligibility for the member, you're on the very end, you will get that miscellaneous document upload. You will then at that point be able to upload the consent form. Or if you're reporting a change again, you will come up to that miscellaneous document upload screen and you'll be able to upload that again. I think for auto association, if you're not doing any eligibility runs or reporting a change, the best way is to again send a secure email to oregon.benefits@odhsoha.oregon.gov. You can fax the form or you can mail. I mean, we recommend the best way is to email it, to secure email that form, or to fax it rather than to mail it. But it's up to you, whatever works for you and the member. Alrighty, and then if Alma can start, Alma, can you start sharing your screen? Let me stop sharing mine. Oh, you got it.
Are you able to see the screen?
I am able to see the screen, yeah. Alrighty. So we just went over the form server. If let me see if I can go back to the form server and get the link so I can share it with you guys. And then I'm going to go ahead and share it on. It'll be on the chat for everybody to see. So it'll be forms server. Okay, so if you want to go ahead and maybe save that under your favorites, that would be wonderful. So you don't have to continue looking for it. And so that concludes the the walkthrough through the form server. Just remember that the consent form is not located within the 7210, so the OHP application, and you must come to the form server in order to have it or get copies to have at hand.
Can I mention one other thing before you move on? Perhaps it fits best here.
Of course.
This is Christy Taylor again. One of the important call-outs points that we want to make, and maybe it's mentioned later, I don't remember. Please don't upload all consent forms all the time. Only upload when you're taking remote signatures right now, when you're taking them verbally over the phone and having that 6610 signed over the phone, or if and when you call in to an eligibility worker and they ask to see a copy. Mostly every time you upload a document, it creates a task in our system, and as most of you know, we have large work backlogs already right now, and what we don't want to do is create extra work for staff to have to go grab.
We might have lost Christy, but she was right on. You can interrupt me, Christy, if you do happen to come back. So the section that we're going to be going over next talks about that. So we're going to go do a little bit dive into the reason why it is recommended to only submit the 6610 if it's signed remotely. If you want to go to the next slide, Alma. Okay, so this is how you will get associated to a case. So for instance, if you're working with the first-time applicants, you are technically associating yourself directly to that case in the One. So once you're submitting that application, you're assisting that member in the One Applicant portal, you're automatically associating yourself directly to that member. You can also send the authorization for community partner help form to the oregon.benefits@odhsoha.oregon.gov via secure email. However, you're sending the authorization for community partner help form if it's a remote signature. So if you're assisting someone via phone, they can come to your office and you're getting that signature remotely, then this is when you need to submit that via secure email. Or uploading the form on the One Applicant portal in the miscellaneous document upload section. And once again, this section will only come up when you're running eligibility screens or when you're reporting a change. Because once you're reporting a change, you're essentially running that eligibility screen. So that's when it's going to come up for you in order for you to upload your consent form. But again, I mentioned, and I already mentioned this, if you're auto-associating to a case and you're not doing a reported change, then most likely you will be sending the consent form via secure email if it's signed remotely. A little bit more on the next slide. Now, when you're working with an applicant that is already known to the One system, and you need to get associated to the case, so the member might already have active benefits, but they're coming to you to get associated so you can assist them with setting up appointments or changing dental providers. If the form is remotely signed, you will need to email the authorization form to Oregon.benefits at Oregon Department of Human, odhsoha.oregon.gov, and then call the CP access line. So you would call the access line and select option 2 if you have a consent form and you need to be associated to the case. Regardless, the member has to sign a consent form, whether they're in person or whether they're signing remotely. The only difference here is that any remote signatures that you get on that consent form, they need to be provided to the Department of Human Services, OHA. And there's many ways that you can do that. You can submit the form by uploading it on the portal. You can fax the form, and we will be able to provide a little bit more information on the fax number. You can mail the copies, and each consent form must be in a separate file. So just remember that as well. And again, I just like to reiterate, we do need a consent form for every applicant that you're assisting. However, the only consent forms that we are needing you to send through a secure email are those remote signature ones. Do we have any questions?
Hey, Rosie. Yeah, there's a few questions that are coming in. A little bit of confusion there. Let me go back to the most recent one. So Vixen posted a question that there's times when she has called into OHA and has been asked to submit the consent form every time and is informed that it should have been uploaded when she did the application.
And I'm thinking that is that's not a remote signature. If I remember correctly, I think she is referring to like non-remote signatures, right? So members or applicants that have hard signatures on the form. So I would let Rochelle or Christy come on and kind of answer that question for Vixen.
Hi, I did just actually post in chat. We do understand there is some staff confusion out there, and we are currently working on getting some clarifications out. Part of the reason this happens is when you submit something and it kicks out for some sort of worker review first, for instance, in a new application scenario, the case isn't created yet. So when you call them, there's no case that they're looking at that shows that you're associated, and they have to resolve the task, and they have to get the rest of the case created based on what the information you submitted. And that's when the association will appear. And sometimes they don't understand that they have to complete certain steps before they will see that you're associated. So we know that they may, at the beginning of a phone call, when they don't see the case, just automatically be asking for that. And we're trying to remind them that they don't have to do that all the time. So apologies. We understand there's some inconsistency, and we're trying to get some clarification out.
Thank you, Christy. I know there was a question as well, and Vixen, please let us know if that kind of answers your question. But I think there was another question about not being able to see, or you haven't seen the miscellaneous upload document screen. Again, that screen only comes on when you're running eligibility or when you're reporting a change. And I'm trying to look for a screenshot of how that screen will look like, but it gives you an option. Again, it gives you an option to upload documents. So that's where you can upload any. And it's important to know, because now that we are in redeterminations and we're seeing a lot of requests for information, members or applicants are providing additional verification. This is one way to upload that information. So I'm trying to look to see if I can maybe get a screenshot of that. I know we have it. We can also send with a follow-up email. We can send the Auto Association more information on Auto Association, and it'll have it on there. It'll be on one of the pages where you'll be able to see what that screen looks like. All right, and then so remote signature authorization, you can fax it. Yes, you can fax the remote signature. So there's many ways that you can provide that consent form if it's only remote signature. Again, you have to have one for every member applicant that you are assisting in your organization. We just need to have you provide the remote signature ones via fax. You can mail it. It is best to email it via secure email, just because, again, it has members' personable identifiable information, but you're able to provide that via those channels. And then we'll be able to, again, I'm going to be flagging some of these questions that have not been answered, so we can have time at the end of the webinar to address those. And without further say, I'm going to go ahead and hand it off to my colleague, Alma. So she's going to be kind of talking to us about the remote signature assistance.
All right, thank you, Rosie. And thank you, everyone, for all the great questions. I think we're getting ahead of ourselves a little bit here. So I'm going to jump into talking about remote assistance, and hopefully this section will help answer some of those questions that have been coming in the questions box. If at the end there's still not enough clarity around some of these topics, please feel free to share with us. So remote assistance, it became effective as of August 21st of 2020. It was for any valid consent, verbal or hard signed signatures were sufficient enough to allow you as a community partner to sign and submit the online, paper, or phone applications on behalf of a primary household member when doing their medical applications. It is a federal requirement that all the remotely signed signatures, which are those that we get over the phone, be submitted to ODHS. So this process is required even after the public health emergency period. And so I know that was a question that a lot of us had. Are we still going to be able to get those consents over the phone? Yes, you will still be able to get that remote signature over the phone. And I'll use some of these terms interchangeably, especially since I know a lot of us are more common with, consent over the phone, but that's what we're referring to as remote assistance and a remote signature. When you are helping someone remotely, whether if it's over a phone call or, video call, whatever your agency's using, that is what remote assistance is. All right, so going into a little bit more about remote assistance. For you as a community partner, you may obtain this verbal consent via the phone by doing these following steps. One, making sure you're reviewing all the information that is on the consent form, the 6610, verbally with the applicant, carefully completing all the fields in the consent form, making sure they're filled out to the best of your knowledge, and printing the applicant's name in the signature line and noting that consent was obtained via phone. Then you submit the consent form for anyone that you're getting that remote verbal phone consent over the phone. And then ODHS OHA will honor this consent form when this process is documented correctly. So again, making sure that we're filling out the form correctly in all the fields and noting that it was a verbal consent. Again, continue to store those consent forms securely according to your agreement with OHA, which is for the 6 years, whether if you have an electronic system, a lock and file cabinet system, just making sure that we're storing those and having them on hand. And I know we talked about briefly the different ways that you can send the form. We're constantly saying send it to the email, the benefits email. There are other ways that you can submit the form if the email system isn't working for you. It is the most recommended since it's instant and someone can access it by accessing that email. But if for any reason you're not able to use that method, we talked also about uploading via the applicant portal, which is not always an option. That option is only generated in certain instances, like when it's a brand new application and a new person to the system. You're also able to fax the consent form in. We'll share the email and the phone numbers and fax with everyone here shortly. You're also able to mail copies of the consent form in to the state. And when you are sending these consent forms, we ask that they all be sent in separate files, never sending multiple individuals information in email or in a fax or in the mail. We really want to make sure we're keeping everyone's information separate and treating it as private as we should be. Any questions coming in that I should pause for, Rosie?
I do need to clarify something. So there is a question about whether someone is needing to upload the consent form with the application, or does it have to be on a separate file? Basically, can we get more clarification on that? Can the consent form be submitted with the application, or does it have to be submitted on a separate file?
And I'm thinking that you're referring to as if you're submitting an application via email, because that's the only time you would be sending things in separately. So if it's that same case, same person, I would send it in with the paper application if you're sending it in electronically and not using the one system. If you are using the one system and the system is allowing you the option to upload the consent with that miscellaneous upload screen and it was a remote signature, I would upload it at that time. And
Right.
I hope that made sense. Any other questions? Okay, I saw that you answered that one. So I'm just going to call it out. So if a person is in person and you complete the application and you don't have to submit the 6610 form, if you're doing an application in the one system and they are there in person and you got a hard signature, you wouldn't have to upload it for a brand new application because they were there and you got the hard signature, but you would have to keep that consent form on file for the 6 years and have it in the event that an eligibility worker may in the future ask you for that form, which at times I can't say it's unlikely, but it may happen. You would only have to submit that consent form if it was a remote signature or if you're needing to be manually associated to a case. For example, if you did a paper application out in the field, you didn't have access to the one system, so you're going to mail, fax, or email us the paper application, then you would need to submit that consent form as well. And I hope that answered your question, Brenda, about when you're faxing in a paper application. Yes, you would have to send in that consent form. Since you're sending in the application, it is okay to send in the consent form with it because it correlates with the work that you're trying to do. The only time we ask that you send it, I believe, in a separate file is if you're sending multiple consent forms. And I'll let policy jump in there and correct me if I'm wrong. But if you're sending in a paper application, go ahead and send in the consent form with it. All right, I don't see any other questions coming in about remote assistance. We do have a remote assistance guide that you can have access through our Getting Started guide, which we shared in the handouts, and it's also available in group site. The remote assistance guide is in process of getting updated with some updated language that we're sharing with all of you today. So if you happen to access the remote assistance guide and see that there's some things that don't match the information we're sharing with today, that is the reason why we're still waiting to update some of the information from today into that guide. And yes, Sandy, you can submit via email to the Oregon benefits. And I did see a question earlier asking about clarity on that email inbox. We are sharing today the correct and updated inbox for Oregon.benefits, which updated. We had some email domains updated at the state, and this is one of the inboxes that has an updated email. So if you're using the old one, please transition to using the correct one, as I can't guarantee how long the old email will be forwarding to the updated and new email. All right, so who can sign the consent form? So we know that the primary applicant can sign the consent form, the primary applicant's spouse who is living in the home, and then a primary applicant's authorized representative. So talk a little bit more about authorized representative. After you assign an authorized representative, there's a form that is mailed out that needs to be completed to finalize that process of associating an authorized representative for the case. You'll still see the authorized representative name appear in the one applicant portal, whether if they have been verified or not. The only way to confirm if that authorized representative is verified is to call in to ODHS and making sure that they are already finalized and truly verified. As a community partner, you should not take applications, renewals, or reported changes from an authorized representative until you have called to confirm that that authorized representative is valid. You may assist Oregonians in collecting signatures on and submitting that form, the MSC 231, which is the authorized representative and alternate payee form that is sent out. But ODHS must review and approve that form before the individual is considered valid. All right, so with the valid authorization for community partner help form, these are some of the things that you're able to do as a community partner. You're able to submit medical applications and renewals on behalf of the members and the Oregonians. You're able to request the status of a medical application or a medical case. You can request that an open task or previously submitted application be processed. You're also able to report changes on behalf of the member's case, including any changes that can be completed in the applicant portal and those that cannot. Even if the change will produce a negative action like a closure or reduction of benefits, you're still able to submit these reported changes. You're able to submit verification documents or other forms on behalf of the member, especially when they get like those RFIs, notice of actions. These are the type of documents and instances when you would submit that information. You're able to establish a medical date of request, referred to as a DOR, on an Oregonian's behalf. The application must be received within 45 days of the DOR to be honored. And as a community partner, you can report this again via email, phone, or fax.
And I do want to say, Alma, if I can, now that we're in the redetermination period, we will be seeing a lot of requests for informations and definitely those due dates, right? That the member must submit a certain verification or additional verification to suffice that request for information. As a community partner, you're able to extend that date, that due date. So for whatever hardship that family may have, that may not be able to, they may not be able to submit the requested information on time. As a community partner, you're able to push that date. You just have to request for an extended time before the due date, but you're most certainly able to do that for families as well. And we have a couple of questions here. I don't know if we have policy here, Christy or Rochelle. Can someone's legal guardian sign the authorization form? Okay, they already got that.
Real quick, Rosie, I'm going to answer a question about the acronym I use, DOR, before we move on, just because we just shared that info. So the DOR is a date of request. Let me share with you a little example of what this would look like when you as a community partner are trying to establish a medical date of request on behalf of a member. So if an Oregonian calls a CP, so say they call your office on April 25th, to request for help in applying, but you as a community partner are unable to meet with them or submit an application in applicant portal until the following week, so say May 4th. So then originally April 25th would be the established date of request because that's when they initially had asked for assistance in applying for benefits. So, but based on the submission date of May 4th, when you actually got a chance to meet with them and do the application, if approved, one will begin the person's benefits effective May 1st because it goes back to the beginning of the month of the date of the application. As a community partner, you can call the One Customer Service and report the earlier date of request and ask that the medical start date be backdated to April 1st instead of May 1st. So in this scenario, the application must be submitted and received by ODHS within the 45 days of the actual date of request in order for that date of request to be honored. If it's received beyond that, the submission date is the date of request the agency must use. Does that make sense? Please pop in any questions if that's still not clear. I think this is one of those gray areas and things that we don't openly have a lot of conversation with you as a community partner, and this may be very new information for you. I'm not seeing any questions.
I do see one. It's on the representative on the consent form. What happens when patients can't sign this due to medically unable to do this? So at this point, we would ask for community partners to work with the applicant in contacting Oregon Department of Human Services in order to do that, to provide that assistance and for them to submit a medical application, because there wouldn't be a way for. So it is recommended for you to just guide them and let them know that they would need to call the Oregon Department of Human Services and go that route.
All right, thank you, Rosie. I'm going to go ahead and jump to our next slide just to do a little bit of an activity with all of you. So here, true or false? Please select the card. Please let me know what card you think it is. Share in the questions box. So CPs always need to submit a copy of the 6610 form after associating themselves to the case. CPs must be an active assister with an assister ID in order to be associated to a case. Eligibility worker currently can only assist and answer questions about medical eligibility and benefits. Only the assister associated to a case can submit information to ODHS for that case.
So let's answer the first one. So CPs always need to submit a copy of the 6610 form after associating themselves to the case. Is that true or false?
So first one, are we thinking
So I'm getting a mix of trues and falses here.
That might have been my fault. I read them all at the same time. Sorry, everyone. So the first one is, do we think that's true or false? So true, false. I'm going to click on it. False. So community partners only need to submit a copy of the 6610 when they gather the signature remotely or when they request ODHS staff to add the association manually. All right, next one. Do we think that one is true or false? A CP must be an active assister with an assister ID in order to be associated to a case. True, 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 true. Saw one false. All right.
Getting quite a bit of truths.
Yeah. So yes, true. Eligibility workers reference a list to see if community partners are active. So if you think you are active, but an eligibility worker cannot find you, we ask that you please reach out to our CP business for assistance. All right. Third one. Eligibility worker currently can only assist and answer questions about medical eligibility and benefits. True or false?
Quite a bit of falses.
False, false. Couple trues. All right. So let's click on it. So true, workers can currently assist community partners with questions that fall into the scope of the medical program.
So if maybe they have any other benefits, TANF or SNAP, ERDC, workers can only currently assist CPs with questions that are related to the medical program.
Let me show the question. And
yeah,
I'm showing the question again. It's because as a community partner, you're only certified to assist with medical benefits. So I think that's kind of where the gray area is.
Yes, correctly, Daisy. So if you have the member with you, they'll be able to share more about other benefits other than medical benefits with them, but not directly just with you.
This one was a trick question, so
Yeah.
kudos to those who got it right. All right. Only the assister associated to a case can submit information to ODHS for that case. True or false?
And I think that was one of the questions earlier. So this is going to answer that question.
All right. Got mixed responses, true and falses. So false. All assisters within that organization of the associated case, and this, I think I read that wrong. All assisters within the organization of the associated assister can help with the case. So if a member is associated to your organization, any assister within your organization can assist with that case. You're all covered under the organization umbrella. All right, perfect. So we have a couple other ones here. So first one, CPs cannot request closure through applicant portal. True or false? Okay, good. I like the honesty. I don't know. Good. True, false. So this one is true. As a community partner is not able to enter a closure request through the applicant portal. However, you can send a member's signed request into the Oregon.benefits email. All right, next one. Community partners are authorized representatives. True or false? All right, couple mixed truths, falses. All right, false. Community partners should never be listed as authorized representatives on a client's case.
And if I can just add, if you are needing to be an authorized representative for someone, you would just need to connect with another community partner to go through that process of getting verified through the Oregon Department of Human Services and filling out the MSC 231, I believe. So you're most certainly able to be a representative for someone, a family member, a friend. But as a community partner, you don't want to be an authorized representative on anybody's case.
All right, perfect. Next one. A community partner can enter a new application in applicant portal when taken from a person's authorized representative. True or false? All right, seeing quite a bit of truths. So false. An authorized representative must be verified by ODHS before a community partner can work with them on behalf of a client. So if we go back to that part on who can sign on a case, just making sure that the head of household primary applicant can assign an authorized representative, but until they've been verified by ODHS, then as a community partner, you're unable to work with them and make those changes until you have verified that it is a valid authorized representative. All right, next one. Oh, I gave you guys the answer. I got click happy, but hopefully I clicked out of it fast enough. So community partners cannot complete non-Magi interviews on behalf of clients. True or false? Got a few truths. I don't know. Okay, maybe I clicked out of it fast enough. All right, so it is true. Community partners cannot complete interviews on behalf of clients. Those interviews have to be done by the client.
Unless someone requested to see the question on the third one. So the false and the authorized representative, yeah.
So a community partner can enter a new application in applicant portal when taken from a person's authorized representative. And if you have any other questions, we are at that time where we are actually opening up our Q&A. We still have about 15 minutes left of our webinar, so please let us know what questions you have, anything that wasn't clear, anything related to the form server, the resources we shared today. And also checking in with our subject matter experts with policy. Anything you would like to add that we may have missed or additional context to the topics we covered today?
I think that a lot of the discussion we've had today about authorized representatives may be new. We've recently landed on some of this guidance and how this has to work. And so I welcome any additional questions we have because we can't afford to get this wrong. I think the one call out that we really didn't mention about that is that if someone requests an authorized representative as part of their application, that representative's name is going to visibly appear in your applicant portal view, like on the case. And you will not be able to tell whether that representative is authorized, verified, or not. So again, just to reiterate again, it's not that you can't work with them, but the agency has to take steps to verify that authorized representative with the 231 form and code them in our worker portal side of one as verified before you can collect consent from them and then start working directly with that person's representative. If there are any questions, though, I'm very happy to continue to answer those.
Thank you, Christy. And I'm trying to go through the questions. I'm going to try to get to all of them. So I see that there's one specifically about the one portal to upload the consent forms. This option will not always be available, especially if it's already an existing case in the one applicant system where you'll be able to upload it if you're obtaining that remote signature. I believe one of the main instances where you will see that miscellaneous upload screen be generated if it's a brand new applicant and that is not known to the system. It may give you the option for miscellaneous upload. This is why we don't really reference it too much because the system works in funky ways and it's generated only at certain times. For any of those remote signatures that you are getting, please send it in via email, which is the most recommended way, but there are the other methods, such as fax and mailing in that we'll be sharing with all of you. A lot of questions coming in about today's session. It is recorded and we will be posting it to group site for all of you to go back and reference, as well as emailing it out to all the participants.
Jenna, so there's a question here. When sending a secure email, do we use our company secure email? That's a great question. So I'll make a note. We do have a secure email guide when emailing personable identifiable information for applicants and members. We will be sending that your way, but it'll be anytime that you're connecting or contacting Oregon Department of Human Services, OHA, you will need to use that secure email guide. So I will send that as well in the follow-up email.
And just adding to that, we shared the Getting Started guide with all of you today. You'll be able to find links to access the secure email guide and how all the important components that should be included in those emails and how you send them to the state. So please make sure to reference the Getting Started guide. It'll help answer a lot of questions on navigating our systems and reaching our teams at the state level.
I know folks are wanting a Q&A as well in the follow-up, so we can we'll get together with policy and Rochelle, Christy, and verify that everything that we are sending out on that Q&A is correct. So it might take us a day or two, but we'll provide a Q&A as well.
All right, perfect. I'm not seeing any new questions come in. As a reminder, if you ever have questions that we weren't able to get to today or they come up later, always reach out to your ROC. Your ROC is one of your biggest support systems and can help answer those questions or find answers for you with our subject matter experts. Hi, Nancy. Saw your question come in regarding the expansion on July 1st. We'll be sharing a lot of information. I believe our website should already be updated and our FAQs will be updated. That might be able to help answer some of your questions. Rosie, do you want to do you have the link for the Healthier Oregon website that we can share here just to direct folks as we're still drafting up messaging and communications related to the expansion?
It's going to be posted on the chat.
Thank you, Terry. I know a couple of our subject matter experts and colleagues worked really hard on this presentation, so that feedback is greatly appreciated. And the old email for community.outreach. So let me go back to one of the slides that has it, or the Oregon benefits. So this is the correct email we should be using for Oregon.benefits. The domain is now at odhsoha.oregon.gov. And all of you will get a copy of this and have access to it via group site. So if there's something you don't recall from or required to be taking notes, you'll have access to everything we shared today.
Hey, Terry, that's awesome. Terry said they really love the slides today. So kudos to Rochelle and On for they were the ones that created the slides. So Alma also liked them too.
Oh, and Melody had a question. I must have missed it about legacy health. Let me find it.
There's quite a bit of questions. Melody, would you mind asking the question again?
Yeah, I'm having a hard time locating it in our history of questions just with the.
Yeah, I can't find it here.
Okay,
Oh,
there. I'll let you take it, Rosie.
Okay, let me read that again, Melody.
And if policy is here, I think they might be able to provide some guidance on this. This is a very unique type of case.
Very specific, yeah.
I'm not seeing it. I'm sorry, I'm scrolling as well.
So
it's
Melody,
at the very bottom.
yeah,
it's the one.
Melody
Sorry?
reposted it for us. It should be one of the last questions in the questions box as she reposted it.
Oh, okay. Oh, okay, one moment.
I can read it out loud, Christy. So Melody
Oh, I
states,
can see it, yeah.
okay.
I can.
Well, Christy's reading that. So Leslie, to answer your question, if it's a remote signature that you have a remote signature and you're assisting with an application, we do want you to upload the consent form. If it's a hard signature, you have the member applicant with you and they gave you a hard signature. You don't have to upload that consent form, but you do have to keep it for your records for at least 6 years. You may need it. Maybe an eligibility worker might ask for it. So it'll be handy for you to just go get it, scan it in, email it, secure email it, and you'll be fine. But if it's remotely, upload it. If it's not remote signature, don't upload it.
And let me just add a little bit of context to that. So there's a couple of different ways that you help an individual complete an application. You'll either do it on the one applicant system or you'll do a paper application most commonly. So when you do the application on the one applicant system and you obtain that phone consent, you would have to send in the remote signature signed form to the state, whether if it's via the upload screen, if it generates for you, or via email or fax or mail. If you do a paper application and you get that signature in person, you would still have to send in that consent form because you did a paper application, as well as if you did a paper application with them over the phone, you would have to send in both the paper application and the signed consent form, whether if it was a hard copy or verbal. The only time that it kind of changes is when you do the application in the one applicant system and you obtain a hard signature for the individual, you would keep that on file for 6 years. But if you are doing it in the system and you get a remote signature, you would have to send in the form, whether if it's via the miscellaneous upload screen or email or the other methods. Hi, Melissa. I saw your question. So if your client is already on OHP and you have a hard signature and need to be associated, do you send it in? So if you auto-associated via the one applicant system and you got a hard copy, a hard signature, you would not have to send in that form. You would only send it in if you got a remote signature because you help the individual in the one applicant system.
Yes, for both. So either, Berenice, whether you have a remote signature or a hard signature, all consent forms must be kept on record for 6 years.
All right, Melissa, I saw you added additional context. So the client was previously helped by another person, most likely in another agency, and now they're wanting you to help. If you're auto-associating to that member via the one applicant system and you're getting a hard signature, no, you would not have to send it in to us because you're auto-associating using the new auto-associate feature within the one applicant system. You would have to submit the consent form if you got a remote signature for that auto-association instance, but not the hard signature.
And Melissa, if you're not aware, not aware, but if you are not familiar with the auto association, I would recommend reaching out to your ROC and going over that auto association feature. It just became available in April, I believe, right, Emma? April?
Yeah, we
27?
just launched in April for auto-association.
So you're able to search a member by first, last name, date of birth. If it's a match, you can auto associate to that member automatically via the one applicant portal. Okay, yeah. Yeah, so reach out to your ROC. I think that would be your best route, and they'll be able to provide you more information, handouts, and how to navigate that auto association feature.
All right, thank you. Well, we are at time, everyone. Just want to say again, thank you for joining us today and for all the great questions. Originally, we didn't anticipate that we would go the full hour and 15 minutes, but we did. So thank you so much. I want to just share with all of you our next webinar opportunities that we will be having. So July 11th, we'll be having a webinar about our MET group Keep Covered campaign, and then July 26th, we'll be having an opportunity on continuous eligibility. So please join us if you're able to those days. If for any reason you're not, again, our sessions are recorded and will be posted to group site for all of you to go back and listen into.
It was a pleasure having you guys here, and thank you for allowing us to bring you this information. You guys have a wonderful Wednesday.
Thank you, everyone. Have a good day.
Thank you.